What if the way that you're feeling, the symptoms that have been dismissed as just part of this stage of life or attributed to stress have a deeper root cause? And it's one that, with the right care and expertise, could really be addressed. We're bombarded by health information on the regular, but none of it is geared toward you. What if healthcare could be truly individualized? My guest has over 15 years of experience in the nursing field, including family practice and endocrinology. And for the last decade, she's shifted to functional medicine after realizing she wanted to offer patients a deeper, more comprehensive level of care than the traditional model often allows. She brings extensive experience in hormone replacement therapy, thyroid disorders, women's health, gut health, nutrient deficiencies, and whole body wellness optimization. Her approach is rooted in uncovering and addressing the why behind symptoms so patients can achieve lasting, meaningful results. And she says you deserve to feel better. And I can't wait to talk with her more about how to get there. So, with all that, I'm delighted to be joined by
Elise Clark.
wonderful Elise. Thank you so much for joining.
Yeah, I'm excited.
I think one of the, like, misnomers I'd like to hit, like, at the very beginning is, do you have to be a certain age to start thinking about your hormones and a lot of the functional medicine route of healthcare?
I think that is a common disservice that we do to women, even at younger ages in teens and 20s, if they feel like they're having hormonal issues, whether that's presenting as like a lot of acne, PMS, irregular cycles, stuff like that. Often they're just told, you're still growing, you're still maturing, don't worry about it. Like your hormones will regulate themselves. And then even into our 30s, I feel like we're often dismissed when we bring our issues to the more traditional setting, like OBs and things like that, who I love my OB, but they often aren't educated as much in just hormone balancing and what hormones you can use to help someone feel their best. And so I think if there's a woman and she's questioning whether something is wrong with her hormones, she should have access to that testing and to someone who knows what they're talking about because it's not always that, an 18-year-old who feels like they're having hormone issues needs to be put on something. But at least I think women deserve to know what's going on in their body. And this was true of me too. So the sad reality is just that we get no education on this. Like growing up, like even in nursing school in my master's program, women's health is not emphasized outside of having babies. And so a lot of us kind of fall through the cracks because the education isn't there for the people who are supposed to be experts. So a lot of this for me was like continuing education, learning on my own. And so a big piece of what I like to do, even if someone, again, doesn't need anything with their hormones, I want them to know how their cycle works, when you should expect a progesterone to peak, when you actually ovulate, because especially in Texas, we don't get good education on that, even as kids.
Okay, something that you said in there that I see as a recurring theme in this area is this idea of like being dismissed. And maybe that word feels even too strong for some of our listeners, and others are like, yes, absolutely. But
Yeah.
there's this sense of like being told that it's something else or that it's something that's normal. And I think many people, when they're told by a doctor, like, hey, this is normal, you're within normal levels, but you feel different than that information that you're getting, that is the battle that I think is an intersection of education and the right providers and all of that. But what would you say to somebody that's listening that's like, I did hear something different from what I'm feeling. How do I know when to go further? Like anything around that.
Yeah. Well, that's often why people find me because in the more functional setting, I have the time and I can
Mm.
just do more testing, and my appointments are really long. And so I can do that deeper digging to help someone figure out what's really going on. But so a lot of my patients come to me because they have already asked their OB, their primary care, et cetera, and said, I don't feel good for XYZ reason. For women, a lot of it is I feel tired. I'm having a lot of PMS or heavy bleeding. I am not sleeping well. My mood is changing. And then when your hormone levels are checked and everything is in normal range, that's the common thing that's said because it's not like your testosterone is zero. But what I commonly see is your testosterone might be at the low end of normal now, whereas when you were younger, in your teens and 20s, it's going to be at the top end. So you're going to feel really good. And we do know that the common, I think, misnomer about hormones is that you don't really have issues until menopause, which is just completely not true. We go through big hormone shifts in our 30s, again when we turn 40, our mid 40s. So there's like 10 to 15 years leading up to menopause where we actually see decline in hormone. And that's where we can, like what I do is where I step in. I'm like, yes, your progesterone level is technically in the normal range, but it is different than it was. And there's also no reason why we can't use these naturally occurring hormones to help you feel better. So normal does not mean optimized, which I hate to use that word because I feel like it's so overdone now. But in my world, it means like I'm going to take your testosterone from a 5, which is technically normal, up to the top end, which is 45, 50, or even higher if we need to for symptom relief. So there is that discrepancy between what's considered normal and what's considered optimal, and even within that, I think there's some nuance because we don't know what your levels were when you were 25 for most of us. So it's about kind of getting you back to where you were feeling your best. And even within that, it's like I don't just rely on numbers on paper. I'm going to treat my patient and their symptoms regardless of what I see on the lab results, anyways.
Yeah, and Elise, I think that that has to do with or takes me into the question around ensuring our listeners understand maybe even the difference between traditional medicine and functional medicine. So maybe we can back up on that front because I was just struck by I've worked with a functional medicine provider for several years, so I'm deep into how the appointments run and things like that. But even what you were just saying there about like maybe a traditional provider looks at the numbers, and I hear you listen to the human that's behind those
Yeah.
numbers and those shifts. So perhaps can we level set about functional medicine? Like what
Yeah.
drew you kind of into that?
Yeah. So I think, again, functional medicine means different things to different people, but it is the term that best describes what I do. I like to think of functional medicine as the way medicine was traditionally intended to be practiced, like originally, because it used to not be about pills and in and out 10, 15-minute visits or putting band aids on things. It's looking at the whole person. So their stress levels, their sleep, their lifestyle, their diet, their nutrition, so all those factors that they have some control over. And then also looking at blood work and not just blood work, but gut testing, food sensitivity testing, toxin testing. There's a lot of rabbit holes we can go down, but it's really about looking at that whole person approach. So typically in functional medicine, most of us don't accept insurance because we need the time to do all of that. So appointments are 1 to 2 hours. You can always do labs through insurance through most places though, which is the good part. But you're kind of paying for the service that you want, honestly. And there are some, depending where you live, there are some good functional practices that have figured out how to work within the insurance model. But typically, it's going to be more of that like pay per service because you want that deeper look. So, functional medicine, I think the actual definition is looking at the root cause of what's going on. To me, it just means looking at the whole person. So, like often at my appointments, I do labs initially before I see people at their first appointment. I'm looking at labs that have to do with your female hormones or male if you're a guy, thyroid, adrenals. I'm looking at a lot of different vitamins and minerals, inflammatory markers, like in-depth looks at your metabolism. So like insulin resistance, cholesterol, all those things. And that gives me a good foundation of what we need to focus on because sometimes people's hormones are good and it's actually that they have no vitamin D, their iron is terrible, they're really inflamed. And so it's not always just hormones, but that is because I work in women's health, like a really big specialty of mine. So I kind of look at everything through the hormone lens. Not everyone in functional medicine has that particular specialty. But for the most part, we're going to look at all the different ways we can make you feel better. So, lifestyle, sleep, stress, supplements, prescriptions when needed. So, it's not that it's anti Western medicine, it's just using those modalities when appropriate instead of just having that more quick fix approach of like, your cholesterol's high, let's give you a statin when it might be that your thyroid is low. You went through menopause, so you don't make estrogen anymore. Your lifestyle is crazy. You're not sleeping. So it's thinking about those problems as like multi-factor contributors instead of just looking at a cholesterol and saying, you need a statin.
That multi-factor and the holistic and the whole human, I think that's what drew me into it as well, and the idea that my provider could go down the prescription route if needed and but wouldn't start there necessarily. There was something about
Yeah.
that really aligned to just my own values around health and wellness, and so I'm curious from your view as a functional medicine provider, what would you say is flourishing for your patients?
Well, I think that for a lot of women in particular, it is getting through your day without being tired. Like, I think fatigue is a huge thing that we as women just kind of get used to. And then we're like, it's not that bad. Like I feel like honestly, so many things. It's like, well, my period's really heavy now, but it's not, it could be worse. So to me, a lot of it means getting through your day, whatever that is, if you're a stay-at-home mom, if you're working with kids, if you don't have kids, whatever that is, getting through your day most of the time, because there's always going to be those days, right? Where you have energy to sustain, you're not irritable, you're not having hormone symptoms like hot flashes and night sweats, and you just feel they think to me and like personally this is kind of how I view it is like I can baseline get through my day no problem with energy and clarity. And then as obstacles come up, I adapt better. And they might knock me down, but I can recover.
I
Because
really
of
like
course,
that.
like yeah, like with kids, with life, everything, like you're gonna have crappy days. And you're gonna be tired sometimes. But overall, I want your baseline to be I have energy, I'm engaged, my mind is clear, my mood is good. And then when you do get knocked down, it doesn't take you a month to recover.
Okay, I wanna go more into the idea of optimization, so I have this question I wrote down over here, where is it?
Okay.
Is there such thing as over optimizing our health?
100%, yes. In my world, like, everything is possible, right? Like, I'm not constrained by what insurance tells me I can do, so all the things are available to me, peptides and nutrition and all of it. I think we can do too much. I
Mm.
really do. And I also think it's for some personality types, it's really easy to get in this functional mindset of like every number has to now be optimal. But what I always go on, even within what I do, which is optimizing people, is how do you feel? Like, yes, I want your thyroid hormones to be at certain values to be considered optimal. But if you feel great and you're not having any symptoms, I'm not going to push something for the sake of a number on paper. And I do think that sometimes perfectionists get into this functional medicine world and want to optimize and want every single thing to be perfect on their blood work, or they want to try everything that's available because they hear this will prevent dementia, this will keep my energy up. So there is definitely a category of people that overdo it. And like I am a fan of all the biohacking things as well, but it is not realistic or feasible for us all to have a cold plunge, have a sauna, all do hormones, all exercise every day, all eat clean every single moment, and then do peptides on top of that. Like there are certain limits to what is realistic, and I don't think all of those modalities are even beneficial for everybody. I'm a big fan of getting your blood work done and talking to someone about your individual needs and your individual goals to see what's realistic because no one needs to be spending an arm and a leg just for the sake of health. There's usually a handful of things that are beneficial.
I'll tell part of my own story, which is I started working with a functional medicine provider for gut health work, and we eventually took out gluten, dairy, and soy, but there was a time period in there which they also had suggested, like, all grains, and I was like, too far," like,
Yeah.
without an exact, like, "This is why," and so I found that if it was so stressful to, like, approach eating to be exactly in those rules, that's where I had to back off and push back a little bit to say, like, "If you can show me, why we need to do that, I'm in. I'd done all this other work." And so I found my right balance with my provider of, like, these things really did make sense and did reduce inflammation, ultimately led to gut health healing, anxiety healing, lots of great stuff from that work, but there was a too far for me to
Yeah.
say, like, "I don't know." But I guess each person kind of finds that in their pathway
You're
and
exactly right, like, every patient is so different, like, some patients can do the super clean eating,
then
and they feel great, and so it's easy for them to implement, but then I also feel like some recommendations sometimes actually, to your point, create anxiety or, like, disordered eating or things like that, so we do have to be mindful of, like, what is realistic for the person, and then I think if people are consuming this information online and don't have that one-on-one relationship with someone, like, you need to stop and ask yourself, why am I doing this? Am I noticing a benefit, and is it sustainable?"
So you named some of the things like the symptoms that often bring people in. Are there things that you see on a recurring basis that they might consider being more educated around? Maybe we can speak to some of your favorite modalities
Mhm.
generally and what people might come in for. So I'm looking for like the pathway of like, helping them start to individualize. If I'm struggling with this, what might be solutions I would talk to my provider about? This is not an official medical diagnosis or, whatever we have to say there, but I'm just curious,
Yeah.
like, imagining that pathway of, okay, if this is something like I'm experiencing an irregular cycle and I've had it for this long, like, I might wanna talk about this.
I think with my general patient population being like late 20s and up, primarily women, a lot of what I think about is hormone shifting and changing as we're aging. And so, like, the most common things that I see, I can, of course, only speak to my personal experience and my patient population. The most common things that I see are people coming in for perimenopause and menopausal disorders. Things like hot flashes, night sweats, joint pain, irritability, drastic mood changes, low libido. Like those are the common things I see in that patient population. And then I also have younger patients that I see who have PCOS and or now it's called PMOS. But they have irregular cycles. They're struggling to get pregnant. They're struggling to lose weight. So there's this whole like, metabolic component there. So I think how I think about people, like when I am meeting someone, I do a detailed history, I get all their symptoms, and it kind of starts to put puzzle pieces together for me
Mhm.
already. And then I look at their labs, and oftentimes my number one foundation is what are your hormones? Like, is your thyroid at a place where I think you're metabolically stable? Are your ovarian hormones really well produced? Are they out of range? Are you low on anything? Because there's not just normal, there's also certain balances we expect to see with especially estrogen and progesterone. So I'm always going to make sure that's okay first. So I look at it a lot from a hormonal perspective initially, because that's most of my patients are dealing with some women's health issues. And then on top of that, I am thinking nutrients. So, are you low in iron? Very, very common in women. Are you low in vitamin D? Extremely common in women. And then there's things like B12, folate, zinc. All those are actually really important too. So then it's kind of like I think hormone as our foundation, nutrients as that next to it foundation. And then beyond that, it's looking at lifestyle, metabolic health, and all of those modalities end up getting very individualized. Insulin resistance is actually a huge thing that I see, and that causes a lot of weight resistance in women and disruption in ovulation and hormone health. And so, correcting those metabolic issues, a lot of it can be done with lifestyle and certain supplements. And so that's kinda how I view it, like, my foundation is hormones and nutrients, and then I start to add on from there, like, do we need to do intense gut work? Do we need to do, like, more restrictive with the eating because you have autoimmune problems? And so it's kind of that's how I always view my patients, within that context of hormones, nutrients, and then we branch off from there.
I think you just laid out such a beautiful picture of functional medicine and the idea of holistic nature, like, around the human, right? Versus around the
Yeah.
system itself.
Yeah. I always tell people, I'm like, what I do is not rocket science. I am not smarter than someone else. I just happen to have more time to do what I think we all want to do, which
Yeah.
is look at more information for the patient, talk to them more about what's going on, Because so much of what we can fix with how people feel comes down to those things that are more in their control, like I said initially, like how are you sleeping? How are you managing your stress? What kind of nutrients are you putting in? That kind of thing. And so really getting those foundational lifestyle things in place can have a huge difference too, which again is like the original model for what I think all physicians wanted to do. There's that old, like, Hippocrates saying that I think every doctor has on their wall. It's like, "Let food be thy medicine."
Yeah.
So, it is true. There's just so much truth to, like, kinda getting back to the roots of things, but also, like, modern medicine and medication is pretty cool. So, we should use it when we need it.
So, one of the areas that I know you are interested in debunking is around the connection between hormones and cancer. Can you take us on a bit of a learning journey of the hormones that are in birth control, how those are different generally from the ones we're talking about in hormone replacement therapy and the cancer stuff? Like, take us on a journey there.
The word hormone and even estrogen and progesterone gets used to describe the whole spectrum of hormones. So there are synthetic ones that have been chemically altered that are not identical to what our ovaries naturally make, which are the things that are in birth control pills and what used to be prescribed as hormone replacement therapy. And then there's what I do and what is known to be very safe, which is bioidentical hormones. So if you hear the term progesterone, when I say it, I'm referring just to bioidentical what your ovaries are making, because there's a difference between how that is processed in your body and progestins, which are the altered form of progesterone. And same thing with estrogen. Like when I'm talking about it, I mean estradiol, which is the dominant ovarian estrogen. When a lot of people say estrogen, they also encompass the things that are synthetic. A really popular estrogen for a long time was called Premarin, and it's from pregnant mare's urine. That's where they get the name. So it has a little estrogen in it, but it also has a ton of estrogens that are native to horses, not humans. So we didn't process that all that well, if you can imagine. So you have to first differentiate what hormone are you talking about here? Is it the good kind that's very safe, or is it the synthetic kind? Now, I'm not completely against synthetic hormones. Like, I think, especially in younger women, birth control pills are awesome because they're not often able to, stick with like an IUD because they haven't had kids, which is a little bit safer. We want to make sure that we do prevent pregnancy when we want to, or if there's like crazy symptoms of PMOS, we kind of want to shut the ovaries down for a while. The problem with synthetic hormones, especially in younger women, is they're not really educated on how they impact the body. So, when you're taking birth control pills, usually it's a mix of progestin and synthetic estrogen. And what that does is it tricks your brain into thinking that it doesn't have to make its own hormone anymore. So, it actually works on the pituitary gland in the brain. It shuts down what are called the FSH and LH signals. So, then your ovaries don't get stimulated. So, you don't make your own estrogen or progesterone, and then you don't ovulate, so you can't get pregnant. And again, it provides a lot of symptom relief for serious issues like heavy bleeding, pain, cysts, that kind of thing. But in the long run, if you stay on those hormones, your ovaries stay really suppressed, so it can cover up problems. You might not know that you had PMOS because you started a pill for pregnancy prevention and didn't come off of it for 10 years. And then now you have irregular cycles and you gained weight and you have acne. So it can just kind of hide things. But then in the long run, too, it actually causes inflammation. It increases something called the C-reactive protein, which indicates vascular inflammation. Doesn't happen in everybody, but it can cause inflammation. And not having your own estrogen and progesterone production, it can cause symptoms like vaginal dryness, low libido, dry skin, mood changes. And again, when we're younger, usually our bodies adapt to that pretty well. So I'm talking like teens, early 20s, don't often see problems there. But a lot of my patients will come to me in their late 20s, early 30s with all these symptoms. And I look at their blood work. I'm like, oh, your inflammation's really high. Your B vitamins are super low because those synthetic hormones disrupt your absorption of that. And so it's worth considering getting off of those things. So that's kind of birth control. And then IUDs usually have a little bit of fake progestin in them, but they only act locally. So it doesn't get full blown throughout your body. So that's why a lot of women tolerate that better because it's not getting all throughout your bloodstream like a birth control pill does. So, a lot of women do great on those for short periods of time. It's always my recommendation is like if you need it for pregnancy prevention, let's do it. But then as you get older, more mature, let's think about other options because we don't want your ovaries to stay suppressed forever. I actually had a patient who was started on birth control when she was really young and like right around puberty. And because she didn't have her own estrogen production, her ureters, which is part of the bladder, it did not develop appropriately because you need estrogen for that. So she has kind of chronic bladder issues. So that's a very, very extreme example, but it's one that I wish women were educated on. So I always just advise people, I'm going to tell you how it works and then you make the decision for yourself. But if I really start to see negative things in blood work, then I start to encourage alternative options. So that's kind of the birth control aspect. But then when you look at synthetic hormones in hormone replacement therapy for like perimenopause and menopause, the big issue was Premarin, which is that synthetic estrogen, which actually ended up not having most of the issue. It's synthetic progestins that caused inflammation and a slight increased risk of breast cancer. So there was one study at the early 2000s. It was either 2001 or 2002 when it finally got released, but it said there was a statistically significant increase in women on hormone replacement therapy for breast cancer. Well, that hit the media before the researchers involved in the study even had a chance to review it. So it's actually like kind of controversial how they did everything, but women got extremely scared of cancer and hormones. It was like an insane amount of women got off hormones overnight. And then doctors stopped prescribing it for the same reason. A black box warning for cancer was put on estrogen. And then until recently, like within the last 6 months, that black box warning was there. So, come to find out, over the last 20 plus years of combing through that data, it wasn't even statistically significant in the estrogen arm. It was the progestin. And even then, it was a mild increase. So, all that to say, we stay away from synthetic hormones. The research on bioidentical, which is just a fancy way of saying estradiol and progesterone, shows no increased risk of breast cancer, uterine cancer, anything. There's a lot of promising research showing it can actually have the opposite effect. Progesterone, in particular, we already know has anti cancer effects on the breast. So it has been debunked. There's a ton of research to support the use of hormones. And there's a really good book if people want to read about it on their own. It's called Estrogen Matters, and it was written by an oncologist. And it's really digestible. Like it's still pretty dense, but it was written for lay people. And it goes through the Women's Health Initiative. They're even pro, like, it doesn't have to be bioidentical estrogen, which I'm still more on the front of like, I will always err on the side of caution with that. But so if you are interested in it and have been scared of cancer, or you have someone in your family who's had cancer, so you want to make sure you cover all your bases, that book's a great place to start, but most cancers are not genetic anyways. I mean, it's a smaller percent than people think. And so even if you have a family history of a female-related cancer, there's really no reason you can't start it, is my point. And the really cool thing, which I think in like 20 plus years, we're probably going to start prescribing hormones to post hormone cancer patients because the safety data there is starting to get a lot better. So, you do not need to be scared of cancer as it relates to estrogen, progesterone, or testosterone. But that doesn't mean just go jump on it and never monitor your levels and never talk to someone about what you're doing. It means you need to see with your particular body what's the best form because estrogen is done as a patch, a cream, or a pill. Progesterone is done as a pill, and then testosterone can either be a cream or an injectable or a pellet. And then estrogen can be a pellet as well. So it does matter with your bio individuality, like what form I would usually recommend for people. But in general, they are safe and they are not going to cause cancer.
It's so fascinating just how information flows and how
Mhm.
research we have some of this in the education space where, like, old research that was ended up being inaccurate, like, sticks for
Yeah,
so much longer
for
than
so
when
long.
we know better and science is really showing it, there's still so much
Yeah.
in like our behavioral psychology that holds us back from some of those shifts. So we see that too. This is back to the optimizing. So thoughts, perspective on the like rings, the health rings and
Oh, like the Aura Ring?
yeah.
Yeah. Okay, so I think it depends on personality type again. So wearables give you a lot of data. And so I do the Aura Ring. I was a late adopter because I was like, this is kind of douchey. That was my thought. but
This is the hot take I
but
was interested in.
yeah, but, like, I mean, the Apple Watch I had before that, and I would track my steps and stuff, but the wearables are really great for people who don't take it too seriously, honestly. Like, if you're a high-performing athlete, that's a different scenario, like, you really need to pay attention to all those metrics, but for the average person, like you and me, we're not training for anything, we're not in the Olympics. It is just about finding patterns that you can change to help you feel better. So for me, I like it because I don't live and die by the information. I really enjoyed the sleep data because it helped me shift my sleep a little bit earlier, which I was already an early bedtime person, but it helped me shift it to where I was like more lined up with how my body was during the day. They call it a chronotype, which I don't know. I haven't ever looked into like the science behind it, but it's been pretty accurate for me. So that was it for me, and then my stress tracking with the biometrics, that was really interesting because my biggest stressors are definitely my children. Which is if you're a mom, you totally understand because it's not that you don't
Mhm.
love them, but it's like you're just always on high alert with them, you know? So, it helped me kinda develop better day-to-day patterns to keep my energy intact, to not get as stressed out, and to really optimize my sleep. But, like, I don't live and die, like, if it tells me I need to aim for 500 calories that day and I don't meet it, I'm like, "Whatever, I don't care." But there are some people who live and die by it, and I never recommend it for my super anxious, like, overachieving people unless I know they're not gonna, like, go too far.
I saw a really interesting use of AI recently in which somebody was using that data along with their AI tool, crosswalked with their calendars to figure out which people and which meetings spiked their stress the most. And they like posted this. Of course, they like blacked out the names of the people, but they were like, I'm just trying to optimize my meeting schedule. Oh, you're high stress. You go here.
Oh
I thought
my
that was
gosh.
hilarious.
Okay, that is funny, but
Also kind of
honestly,
genius.
I bet that's kind of the norm in 20 years. You know what I mean? Like, I bet that'll be so easy to track.
Yeah, and I think too to this, like, idea of, like, optimizing the optimization, not to be too meta, but I do think we're talking here about that flourishing to say
Mhm.
what is right for you and personalizing it with the information that makes sense for you, and I think some of that, at least from my experience, has been trial and error of figuring out like, I like the
Yeah.
idea of a posture of experimentation, and maybe that's even in, like, the health space to say, it's not especially in functional medicine, it's not so rigid that there's only one right way to get there and solve something. But if you
Yeah.
have that information, are working with, an expert provider, then you can it's more of a dialogue and try this, see what happens, like, within reason.
I think that's a great way of putting it because sometimes I can't give a person an exact why, like why they're having this particular symptom, why the typical protocols aren't working. So then we start to experiment. And that is kind of the joy of functional medicine is I'm not bound to the textbook. I'm not bound to the insurance. And so we do often in this space try things that are FDA approved but off label. Like there are medications that we use for different things than what the FDA technically says you should. And I think a big one right now is honestly GLP-1s. We use
I
them a
was
lot
gonna
for
ask about that. Perfect.
yeah. So for the inflammation benefit, so for endometriosis, even when women don't need to lose weight, you can do a very low dose so it doesn't impact their appetite. But the anti-inflammatory benefit of it, it decreases endometrial lesions and pain. I see it a lot with PCOS. We don't always have, PCOS patients don't often have a ton of weight to lose. But by regulating their insulin, you can regulate their testosterone and their ovaries and their ovulation. So these aren't FDA approved uses, but like I even like I have a patient who has Crohn's and that's an autoimmune gut issue and we're doing it for that for the inflammation benefit. So they are probably going to get approval for a lot of different things, particularly the GLP ones is what I'm talking about. But it is that trial and error in our world, just generally speaking, of like, I don't know exactly, but I'm okay saying that. Like I don't need to have an exact reason for everything, but I'm going to try multiple things until we get you where you want to be. And if I can't figure it out, I probably have a friend who can in this world of like, well, that's their specialty. So let's have you see them. And it's a very, like, in general, in this community, it's just a very like supportive environment. We share patients, we talk a lot. So there's just a lot more learning, I feel like, that happens in this space too, even on the provider side.
Are there any topics that we haven't hit that you want to share on?
There's probably too many things for me. I would say in general, there's a lot of wellness influencers, a lot of people that use the functional name as like, I'm a functional provider, and they might not really have a medical background. So I would be cautious of anyone who is over promising anything. Always. And anyone who's unwilling to change their recommendation, like if they say, this protocol worked for me. This is exactly how you're going to do it too. There needs to be nuance with everyone. So, absolute statements are always a red flag, in my opinion. And if you're going to follow someone's advice, look at what their education is, look at what their certifications are. I think that's my biggest recommendation as far as like what's out there online right now. Speaking to peptides, I am a fan of them. I think there's a great promise for them. If you're going to do peptides, if you're going to do anything that's a bit more like out there, for lack of a better term, that's not like FDA approved. We do not have a lot of studies on peptides. There are some animal ones, but humans still doesn't exist. So I would recommend if you're going to do anything like that, do it with a functional provider who's going to prescribe them from a compounding pharmacy. Do not do these companies online that will mail them to you. Per really some horror stories about like heavy metals, no active ingredient even being present, stuff like that. So, anything that you're gonna do, get personalized guidance on.
If only people knew when it comes to women's health and what we've been discussing.
If only women knew they didn't have to feel bad every day.
Mhm.
Or I guess another way to say, like, only women knew that you could probably feel better than you do. And that's for the average person, right? Not the person who's already doing all of the things. But I think as a woman, as a mom, as someone who's working, pushing 40, noticing the changes happening in myself, and like as I'm just basically becoming my own patient that I've seen for years, it's like there is usually something you can do to feel better if your mood's down, you're fatigued, all those things, like your weight's going up. You don't have to just accept these things as part of aging because, yes, it is normal for your metabolic function to decline. It's normal for your hormones to go down, but that doesn't mean there's nothing you can do about it.
Okay, Elise, for our listeners that may want to connect with you or learn more from you or become a potential future patient, will you share any of that information and some of the guidelines there?
The best place is the website. It's my name, EliseClarkHealth.com. And then my Instagram's at Elise Clark FNP. And the website's great if you're really interested in talking to me, or I have a colleague, Morgan, that works with me who does the same thing, functional medicine hormones. That inquiry will get you set up for a discovery call where you can talk to us for 10, 15 minutes, see what you're looking for, see if we're the right fit. And then from there, we can always book. But if you just have like one quick question or you want a resource on something, just reach out on Instagram. I'm always happy to answer that.
Wonderful. Elise, thank you so much. I think that our listeners that are, in this place of diving in are going to find so much benefit from your insights and just the way you pieced it together and shared your own journey too. I think that I'm excited to hear from our listeners and how they're able to use those insights to advocate for themselves with their providers or maybe look for a provider that's aligned to their
Yeah.
values and the things that they're trying to do, and I'm taking away the pathway of advocacy to become knowledgeable ourselves in our
Yeah.
body and in the information we need, and not waiting until you're of a certain age to know and understand things like our hormones for women, and how that evolves over time. So, just wanna say thank
Yeah,
you for
exactly.
sharing your
You're
expertise and
welcome.
yeah.
Yeah, and one thing that I tell my patients is like, if you think there's something wrong, there probably is because you know your body. And I think we have just been told for so long, like, oh, everything's normal. This is part of aging. But like, trust your gut. If you think there's something more to it, find someone that'll help you dig a little deeper.
Wonderful. Thank you so much, Elise. And for our listeners, thank you for listening. One of the things that really helps others discover our podcast is if you leave a 5-star rating and review. So we'd love to ask you for that. And then we also have a newsletter that goes out and we create a blueprint for thought, which is basically a thought experiment that connects with our episode. If that sounds interesting to our listeners, make sure that you are signed up for our newsletter and then you'll get that in your inbox. And I do not spam you because I do not have time for that and nobody wants that. So, anyway, thank you so much, Elise.
You're welcome.